Are you an overwhelmed SaaS founder ready to make the leap from leading a team to leading an organization? Join us each week as we refill your think tank with actionable tips and strategies from great business minds you know and those you don't know yet. This is SaaS Fuel with your host, 5-time entrepreneur, SaaS founder, and globetrotting adventurer, Jeff Maines.
Welcome back to the SaaS Fuel podcast, where we test the limits of entrepreneurial endurance by having SaaS founders listen to the world's most annoying song over and over and over again on repeat. So I don't know, what song is it? You tell me. What is the most annoying song in the world? Well, I'm your host, Jeff Maines. I help B2B SaaS founders like you scale from 7 figures, which is good, to 8 and 9 figures, which is outstanding. We create capital-efficient growth, premium valuation, and freedom so that you build a business that you're proud of without sacrificing your family on the altar of MRR. Well, I had a great time at SaaS Doc last week and heard some fantastic speakers. You know, I think I know every company in the SaaS space. And yes, I do know there are new ones all the time. And there were some of the usual suspects there, but San Francisco Tech Week was going on as well. And walking in there, I had not heard of 80% of the companies, which I really, really enjoyed. You know, there were some really good ideas there. There were a few bad ideas. Some were really well thought out and executed, and others that are just doomed. And not because the idea is flawed, but because their marketing message is completely muddled. You know, I figured out what some of them did. And, you know, I just gave up on a few of them. And I'd tell you that 20% really had their message dialed in. And half of those, the founder could articulate it really well, but the other people, even there, couldn't do a great job. And so, you know, if you aren't 100% confident that you could explain what you do to your grandma so that she gets it, reach out and let's fix that, because it's really sad for a company not to go anywhere and not be really successful just because of something simple like that they don't have their marketing message dialed in and don't really understand. Somebody doesn't understand what they do. You know, I talked to several companies in the health tech space, run a Fintech in healthcare. So that's something that I always want to hear about. Even met a potential partner company, which is pretty cool. You know, we're at the intersection of two fascinating and rapidly evolving worlds, being that's healthcare and technology. And, you know, it's not an add-on or a sprinkle of high-tech glitz over traditional methods. Instead, it's a deep transformative shift in healthcare that's revolutionizing how care is delivered and experienced. And from the patient's living room to the doctor's office, from preventative care to critical diagnosis, technology is reshaping literally every facet of the healthcare journey. I mean, think about the adoption of telemedicine over the last few years. I mean, that innovation alone is just ending geographical and accessibility barriers. You know, it's bringing high quality care into homes and remote areas that maybe didn't have it before. You know, it's healthcare on demand, you know, when we need it, when we want it, right from wherever we are, you know, matching the pace of our fast moving lives. And, you know, there's the digital connection of society as a whole, and it's far better experience for most of us. And because it seemed like, you know, years ago, my kids would be sick, it was always like, you know, the Wednesday night before Thanksgiving, and nobody's going to be open till Monday again. So, I mean, just crazy. So it's really making a far better experience for the majority of us. And I think for the providers as well, because they're able to serve more patients, they're able to service better and from wherever they are. So if somebody has downtime in some other state, then they can talk to me here and vice versa. So I think that's a really cool thing. Add to that the proliferation of wearable technology. I mean, whether it's something, you know, watches or rings, you know, health apps, which are empowering patients in real time to know what's going on with their own health. I think that's a really cool thing. And it's not limited to just those devices. They're implantables as well. Talk to some people who are doing some really amazing things in that space. But the key is that the tools are fostering proactive healthcare, and it's enabling early intervention and making preventative care a feasible reality. That's one of the things we're going to talk about today with our guest. AI, who can leave out AI, especially in today's market? But artificial intelligence, too, is carving its path with algorithms that can sift through mountains and mountains and mountains of data, uncover platforms, and assist with the diagnosis and treatment plans. The result is an increase in service levels and improved patient experiences, making healthcare more efficient, personalized, and most importantly, patient-centric. And as we dive into today's discussion, let's not forget the core of healthcare, which is unequivocally human connection at its core. I mean, that's what it's all about. And the goal of integrating technology in healthcare can never, ever replace the personal touch, but it should absolutely enhance it and free up medical pros to focus on what they do best. And that is to give patients the care they deserve instead of being buried in mundane tasks and toilet paper, paperwork. Sometimes it feels like toilet paper, but paperwork and coding and all the garbage and bureaucracy that comes along with that. But it's really for them, it's about patient experience. That's what they got into medicine for in the beginning and what they're great at. So as we journey further into this new era of healthcare, let's explore, learn, and continue to innovate. Because at the heart of this technological revolution, it's about creating healthier, happier human experiences. Our sponsor today is a health tech company, and that is Intelligent Contacts. Do patients love the care experience but hate billing and finance within your organization? Well, then let's fix that. Elevate the entire patient experience to be amazing. Poor communication and lack of understanding are common complaints in the healthcare industry, especially when it comes to billing. Traditional tools don't work, and even the newer EMR systems, it's an afterthought at best. They're really concerned with the records themselves, not all the financial stuff around them. Intelligent Contacts puts patients at the center of communications, allowing providers to easily connect with them using each patient's channel of choice and delivering self-service options, whether that's over the phone or online, that put the patient in control of their financial responsibility. Simple, understandable, and on their terms, while at the same time, providers enjoy scalable, easy to use, and integrated with many tech stacks. Uplevel your patient experience with Intelligent Contacts. You can learn more at intelligentcontacts.com. Our expert guest last week was Sam Baker, principal at Scale Venture Partners. Sam talked about the future of SaaS and gave the state of the market and unique perspective from a capital partner. My favorite part was about go-to-market repeatability. It's absolute gold. And our founder last week was Melissa Kwan, co-founder and CEO of eWebinar, which is an automated webinar solution that combines pre-recorded video with real-time interactions and live chat to deliver an engaging experience for attendees. Super, super sharp founder who's built a business that she runs. It doesn't run her. And she built it that way on purpose, which is way cool. Too often founders get stuck in their business, so there are lots of lessons learned there. So good. So if you missed either one of those episodes, go back and give them a listen for sure. My guest this week is Dr. Jonathan Baktari MD. He is the CEO of both E7 Health and U.S. Drug Test Centers and the host of Baktari MD. It's a great podcast. E7 Health is a preventative health and wellness company that's been called the Uber of preventive medicine and was named the best technology company in the healthcare space in 2019. U.S. Drug Test Centers is a nationwide network of over 20,000 testing centers in the U.S. and is revolutionizing drug and alcohol testing across the nation. Dr. Baktari has always believed that helping others was the ultimate achievement in life. Welcome someone who combines preventative health with tech entrepreneurship, Dr. Jonathan Baktari. Hey, Jonathan, welcome to SaaS Fuel.
Oh, welcome for having me. I'm so excited.
Well, you live at the intersection of healthcare and technology. Tell me about that journey and how you got to where you are today.
Obviously I'm a physician and I went, through medical school, residency and fellowship, and eventually branched out to administrative medicine and then subsequently got into, sort of entrepreneurship. And it was really that experience in medicine looking at healthcare technology that allowed me to have a window into technology in general. And so when we started our companies, we really focus on technology because I think there's a lot of times people, who start up a company and they just think customer service is going to be the differentiator. And of course, customer service is, you can't live without it. But I really don't think customer service alone is a strategy. You're going to have to bring something to the table that makes your clients' lives easier, provides value. And of course, without customer service, you're sunk. But customer service alone is not going to differentiate you and really make an impact on the people you're serving, which is, your clients as well as, your staff.
Right, right. You hear that all the time as a differentiator. Well, it's service. Well, everybody says that. But really, is it a differentiator? And I think you're exactly right. It's important, but it is certainly not something that sets most companies apart.
Yeah, I think people think, we're going to be the 100th, accounting firm and we're going to kill it by providing great customer service, which if you're the 100th accounting firm in a city, yeah, customer service may take, I don't know why I'm picking accounting, but just you can fill in the blank.
Sure.
Yeah. So yeah, I think it's important to understand you need to bring something else to the table.
Yes, without a doubt. So what is that in your business? What is it that sets you apart? How do you stand out in a crowded market?
Well, again, we have E7 Health and U.S. drug test centers, and now we're rolling out U.S. TPA Gateway. And again, what we try to do is leverage technology to reduce friction for our clients, for our patients, and for our staff. So our staff is really spending the most amount of time with the patients, the clients, and not, doing a lot of just busy work to set up accounts, run accounts, follow up on accounts. All that can be automated. So, if you really want super duper great customer service, have your staff, eliminate all the busy work, inputting stuff, have things auto populate and things being pushed without someone having to manually do it. And when you automate a lot of stuff, it allows your staff to focus on what's really important, which is helping the clients as well as their own job satisfaction.
Sure.
I think we've, there's, if you look at, the old factory assembly line where people are doing the same thing over and over all day long, anything resembling that is not very fulfilling anymore. And to give people autonomy, creative juice, and, let them focus on higher level issues, I think leads to, staff retention, staff happiness, and more productivity, which then translates into the clients being more happy.
And that makes a lot of sense because I hear it a lot. And whether it's nurses or doctors, they spend all the time going to medical school and really they want to take care of people. And then they get into practice and it's a lot of paperwork. It's a lot of administrative overhead. And that's not what they love. And so what you're doing is really kind of removing that and letting them focus on what really matters.
Right. And of course, we've gone beyond healthcare. But on my podcast last year, I reviewed several research articles on one of my shows where it looked at the amount of time a primary care doctor spent looking at a screen during a patient visit versus the patient. I'll have to refer back to my own podcast, but it was something like 80% of the time they're spent on the computer.
Wow.
And so does that really make sense? They should be looking eyeball to eyeball and trying to feel you out and really understand, what your issues are. And, anyone who's been in healthcare or any kind of service industry, a lot of times people don't always say what's really on their mind. So you have to look at their body language, the way they express themselves. And I think, if you're spending all your time, no matter what field you're in, not focus on the client, but you're focused on getting the process done, that's kind of like a DMV kind of thing. So you got to really figure out ways to let your staff, be there and serve the client.
And so you have E7 Health, you have the drug testing. Is it U.S. drug tests?
U.S. Drug Test Centers, that's a nationwide drug testing company. And we're rolling out U.S. TPA Gateway, which is a platform and a software. So that's our third
Tell
company.
me about that. SaaS platform.
Yeah,
very
it's a
cool.
SaaS platform. Currently, for companies who do drug testing, and let's say they have offices all around the country and they want to do, pre-employment drug testing, or random drug testing or any kind of program that may have, or a regulated drug testing program like the Department of Transportation requires. And if there are multiple states, often they have to sign contracts with different providers in every state. What we've created is a platform where up to 20,000 collection centers are connected to our platform. And clients can hop onto this platform. Literally, you could order like 20,000 drug tests the same day at 20,000 locations for 20,000 employees on the same day. And the employee will get a link where they can just show up and show a donor pass. They don't have to make an appointment. They don't have to give any money. And the results will automatically come back to our platform, to the company or the client. So that's what we call the US TPA gateway. And we're currently on it ourselves as a TPA, as a third-party administrator. But we're going to open it up to other TPAs who want to have this sort of A to Z platform to run their drug testing TPA company off of. So we're going to offer that essentially as a SaaS, because they're going to be running their own company, charging their own clients, and we're just going to provide them with the platform.
That's brilliant. And being able to do that and really roll it out to a much larger market than just using the technology yourself.
Right. It's interesting because I think, it's one of those blue ocean kind of things, because there's really nobody who's really done this on any meaningful way. There are other platforms that use a lot of, duct tape, spit and glue and, kind of do it. But there hasn't been a full enterprise solution. Now, certain large employers have developed their own, but they retain that within, their company. Right. But as something that any TPA can hop onto, they wouldn't have the bandwidth or potentially the finances to create their own platform. So we've created it for them so they can just hop on and run their third-party administrative company right off of our platform.
And so I sense a theme here of, making things a lot easier because, we've been through this process and as an employer, as an employee years ago, and it's not an easy process normally. And so it sounds like, you're doing the same thing in making it where it's super easy, not only for the employers, but the employees, where, it's reduces all the friction of making that happen.
Yeah. I mean, we even got to the point where, the employee can get a link and they can actually schedule it at the location they want to go to. So, if there's 20 locations in, Memphis and one is closer to work, they can actually pick their own location where they want to go to have their testing done. So we put in a lot of stuff to make it easy for the employers, for the employee, and for the people who have to manage the data. One of the interesting things that people don't talk about, they keep talking about, like in hiring, the cost of, doing background checks and drug testing, but to manage the data and have it at your fingertips, 10, 15 years ago, so you get faxed the results and you have to file it away somewhere. So what our system also does is it handles it becomes the repository for all the data. So there's no need to then have a separate system where you have all those records stored internally in your house. It's on our platform in the cloud, so you can access it whenever you want.
That's really nice. Mm-hmm. Yeah, we don't want to have those big filing cabinets and try and keep up with the paperwork, especially with some of the information on it and HIPAA requirements. Right. It can get messy fast.
Right. And of course, companies spend a lot of money trying to stay compliant and take precautions. And if we can take some of that work away from companies' clients, it's a real win.
So you really approach technology from a very different place than most other companies. Because you've been there, you came up, as a physician, you've been in administration. Mm-hmm. You approach it very differently than somebody that maybe has an MBA and is writing software for healthcare.
Yeah, well, it's true, but I think practicing medicine, so seeing what the doctors and clinical medicine is all about and what patients are going through, and then being a professor and teaching medicine to students and residents and interns. And then being an administrator, both on the hospital side and on the insurance side, gives me a perspective that hopefully allows me to have a satellite perspective of the global issues that we need to tackle. Because whenever you have any system where 4 or 5 parties are involved, insurance carriers, hospitals, the patient, the doctor, the medical plan, you have to understand what drives and what's the motive for each party to try to address a technology solution that kind of takes that into account, but more importantly, tries to figure out solutions to make it easier for the patient and the staff, provide quality while, I don't want to say those things are secondary, but making your insurance company and hospital and whatever secondary to providing you with great quality and you as the patient or the client with access, making that equal priority as opposed to just being worried about making sure, the maximal reimbursement is done from Medicare or the maximal reimbursement is done from Blue Cross. That's important, but we have to take care of the patient and provide quality.
And it seems like a lot of solutions are kind of written that way. It's really from the provider perspective or from, even it's about the dollars and maximizing reimbursements instead of really kind of patient experience.
Right. Not to say that they don't take that into account, but, I always joke like if a software company came to a doctor's group or a hospital and said, well, we've got this new electronic health records. It's going to, improve patient experience, the amount of time they're filling out forms is going to improve the doctor's experience. However, your Medicare reimbursements will go down 5%. It's a non-starter. So,
right.
So reimbursements become such an important part that takes, and, writing software, one of the things I've learned in being involved with our team that writes software is you can only have certain priorities. I mean, yes, you can say, well, we want to accomplish all 4, but sometimes 1 or 2 in that software becomes the driving force with the other ones, getting attention, but, the priority, the prime directive is, this or that. So, you may have an e-commerce site and your primary thing is make sure those transactions go smoothly. But in terms of, let's say, providing information or other stuff, it may not be so good. But you could, sometimes they don't contradict, but you can only, often have one and not as much as the other, depending on the exact code and how the technology is set up.
Everything can't be the highest priority, right?
Right. And I think, yeah. And, we like to think the patient's quality should be the number one priority. And then we'll do the best we can for the rest of the stuff.
Right. I think that's really interesting. What have been the challenges that you've experienced in, building the companies and particularly the SaaS product?
Yeah, I think, having a product that works for us is interesting because on one hand, it gives us an advantage because imagine like you're a restaurant and you write a software for restaurants. Well, because you're a restaurant, you know what that software should include, right? So I think we have an advantage there, but the disadvantage is we're writing a platform that other restaurants are going to hop onto, and how we do it may not necessarily, how we think. If you're going to have a basically a neutral platform, your own sort of idiosyncrasies have got to be addressed and say, well, that kind of is how we do it, but we can't write a software just for how we like to do billing or how we like to do different aspects of the business. So I think in writing a SaaS, especially since we're our own client, we're the first client on our platform, I think as we talk to our developers and we talk about how to provide more features, we have to be careful not to provide the features that we like or we need, but just to think about the generic client.
Right. So it's not about making it where it fits your process, but you make it where it really is adaptable to other people's processes as well.
Right. And I think early on, maybe that wasn't so apparent, but it's becoming apparent as we've been going through it.
So how is it moving from being in healthcare and in administration and then moving into technology and leading technology companies?
I think the biggest challenge is you need to acquire skill sets that you didn't have and to acknowledge that. I think if people are like, well, if I'm a good doctor, I'll be a good CEO or a good administrator. If I'm a good administrator, for sure, I'll be a good CEO. And or if I'm a CEO of a small company, for sure, I'll be a good CEO of a larger company. And I can see how you might fall into that trap, but you need to get skill sets, new skills as you move on in terms of managing an organization. How you mentor and motivate people, how you recruit, how you retain, how you compensate, how you troubleshoot. It's not intuitive necessarily. It's like, if I could do it, it's like taking out an appendix. You can't intuitively know how to do that. You can't intuitively, intuitively know how to land a 747, right? I mean, put me and you in a cockpit. I don't know about you, but certainly me, there's no chance that plane's going to, land correctly, and so I think people look at leadership skills. I'm a nice guy. I get along with people. People respect me. For sure, I'll be a good leader. Yes, that's probably true, but you also need to acquire skills. So you may be very musically inclined. However, taking piano lessons will really take you to the next level. So I think understanding and acquiring skills is important, and not to say it's all intuitive because, I'm just a good, people like me, I'm a good guy, which may or may not be the case, but not to say that's enough. Keep going.
And so how have you acquired those skills?
Yeah, well, a lot of it is a school of hard knocks, to be very frank with you, because transitioning from physician in terms of that. But then also, I think I learned early on to surround myself with mentors and consultants who know more than me. And, getting in the position where once you really respect and trust someone who is in an area that, you're just starting to get into, is, to really be able to, if I can say, just shut up and listen, you don't want to be the smartest guy in every room. That's definitely not the way to go.
Right.
If you want to acquire those skills, you just have to understand, I give this analogy all the time, but if I met Michael Jordan, I wouldn't tell him how I shoot the ball because it doesn't matter. Right. I mean,
right.
I should just be asking him, well, tell me more. So again, if you're around a Michael Jordan, and that's kind of highfalutin, but if you're around someone who knows more than you, I don't think that's the time to give your take on it because they've been doing it for 20 years. I don't know what your take on it means if you're just getting into it. So yeah, I mean, later on, once you get some of those skills, you may have an opinion. But early on, just understand that if you found these mentors or consultants, just shut up and listen. And that doesn't mean every mentor is the right mentor. It doesn't mean every consultant is the right consultant. But if you do feel like you've got the right person, to just be quiet.
So what role have mentors played in your success?
A lot. I would say a lot. I don't know if I should drop names, but again, they've been all sort of leaders in the industry that we're in. And, I spent, I actually retain as a consultant, but it's become a dear friend. But, I think part of it is really going to conferences, seeking out sort of the Michael Jordans of whatever industry you're in. One of the tricks I did really early on, I signed up for as many conferences that were like the big national conferences, whether it was in drug testing or, some of the healthcare technologies. And I would like look at the courses. This was a long time ago. And I would see who's is doing like an introduction to the industry or something like that. And, and then you could hear their talk and then you would just realize, oh my gosh, they're like 25 years of experience right there. And, why should I figure this out when there's this man or woman there that has been living it for 25 years? So, and then I remember even after one course, just going up to the person saying, hey, that was an amazing talk. I love to, figure out, how I could learn more from you and what things you do and, consulting or what have you. And, just went out for drinks, during the conference and struck up a friendship and, that was the way to go. So, I really tell people, if you're starting out, go one way just to go to a lot of the major conferences and seek out, usually the Michael Jordans of whatever industry you're looking for are pretty obvious. They all have similar qualities. They're all modest. They'll never tell you they're the Michael Jordan of their industry. And they have a sort of a humble, the 3 or 4 people I'm thinking of, very humble and giving and not wanting to well, I can't provide you any information until you sign this consulting agreement.
Right.
So you got to, that usually is a bad sign. But, people who say, yeah, let's go out for dinner or let's talk. And then you actually want to pay those people and you really want to sign them up because, oh my gosh, and it's genuine. It's not like an act to get you to become a client. They will give out information to anyone who asks. And, it's pretty amazing to see. So I don't know if that helps people listening, but, we found that to be a really cool way.
That's fantastic. Well, tell me about your podcast.
Yeah. So last year was our first year of our podcast where we just sort of did the inside scoop on healthcare. And the goal of that year was to tell you stuff that was, inside the locker room, what doctors are really thinking, what hospitals are really thinking. And I really enjoyed that. And we really liked the production level. It was really good. We're just in the process of launching season 2. And season 2 is kind of interesting because it kind of relates to what you asked me earlier, how I learned my stuff. And I told you from making mistakes and what have you. And so we are going to, season 2 is going to be focused and we call it Crash CEO School.
Love that.
Okay. And it's really all the mistakes you could possibly make your first, few years, 5 years. And, why make them if you can just learn from others? So, and the reason I bring that, we decide to go with that is because when I get interviewed, that's often where people go to, like you asked the question yourself. And so I said, well, everyone asked me that question, why not, instead of just giving it out on someone else's show, which I'm only, it's just a little slice, why not do a whole season of it?
Sure.
So that's how we actually came up with that idea.
It's a brilliant concept. Crash CEO School. We'll make sure and link that in the show notes. And
it's on our podcast, Baktari MD, but that's what the second season will be called, Baktari MD on YouTube and Spotify and what have you. And that should be out in the next few weeks.
That's great. So what do you think the greatest risks and the greatest opportunities are in the healthcare space today?
Well, healthcare in general or healthcare technology? I can talk to both.
Let's say healthcare in general.
Yeah, I think the biggest problem in healthcare that I'm sure everyone has noticed, but maybe they don't know what it is they're noticing is, healthcare consolidation. Just like just like there was 15 airlines 15 years ago, now there's 4. And just like there was 10, 15 cellular phone companies 10, 15 years ago, now there's 4. With equity firms and Wall Street buying up healthcare systems, practices, hospitals buying practices. I saw this stat that, I think 10, 15, 20 years ago, 25% of doctors were employees. Now 75% of doctors are employees. And that goes to this consolidation. So I think, if you like what's happened to your cellular phone service in the last 10 years, the direction that's gone, or the service you're getting from the airline industry, over the last, compared to 10, 15 years ago, you get a sense of what's probably is happening and is going to happen. When you get consolidation, the first thing that suffers is service. So I think that's really the troublesome part, weeks and weeks to get to see a doctor. Often can't choose your own provider. You can see the doctor one day, nurse practitioner the next day, another doctor the next time. And it's kind of and also, just trying to call a doctor's office and you get this, barrage of phone things you got to go through. Press 1, press 2, press 3, press 2, and then press 1, press 2. This whole shenanigans. It really screams, healthcare consolidation on a high satellite level.
So what are the opportunities for the market?
Well, in terms of addressing the healthcare consolidation, I think people, who can provide, product that addresses the shortcomings of healthcare consolidation, personalized service, attention, worrying about quality, worrying about patient's experience, worrying about what the patient's thinking, what their needs really are, what their concerns are. There's a statistic, for example, when it comes to patient care, that 1/3 of all primary care visits are for reassurance. I mean, you could say that, you could put that in many different ways, but basically means 1/3 of the time, and I hope this doesn't come off wrong, because let me clarify, but 1/3 of the time, there's nothing wrong, right? The patient just wants to see the doctor, so the doctor or the healthcare provider can say that there's nothing wrong. Right. They just want to hear it. Or maybe they're depressed, but they're presenting as a physical symptom. They're hoping the doctor will figure out that they're depressed or upset. Or I think if you're changing providers every visit, if you're spending 80% of the time looking at the screen, I think those 1/3 visits will probably not be optimal. And so there lies the challenge, because providing healthcare is not like serving up a dish in a restaurant. I mean, the product is the interaction.
Right.
And the product is, what you can give the patient and how much attention you can give them and how focused you can be on them. And the efficiencies, with consolidation don't necessarily address that.
No, they don't. And I think you're right on that. That continuity of care is definitely gone down, because every time you're seeing somebody different, then it's kind of you're starting over again.
Yeah,
and, it's the same story. They can read the chart, but that doesn't tell them everything.
Right. In fact, I mean, you can almost see if you watch older movies and stuff where someone goes to see their primary care doctor, and he says, "Well, Bill, normally, I wouldn't do anything, but I know this will be, I know you, and I know this is going to bother you. So let's go ahead and get the x-ray." Normally I wouldn't get an x-ray, but Bill, I know you, we've known each other for 10, 15 years. I know that, or vice versa. Bill, I know you're, usually you don't want to get testing, and I know you're averse to it, but Lex, in this case, I really think we should get it. Despite I know how you normally feel. All of those interactions are gone. No one is saying, "Bill, I know you, and because of that, this is what I'm thinking." How can they say that? Right.
Some doctors are, just because of the environment they're in, it's 30, 40, 50, 60 patients they have to see a day, and that's the norm.
Right. Plus they haven't, maybe that it's the only time they're going to see you, and then there'll be another provider. And how can you develop the rapport and relationship? I mean, even think about your rapport with your accountant. They know how aggressive you want to be on your taxes, how non-aggressive you want to be, what keeps you up at night versus their other clients. I think you lose some of that if you don't have continuity.
Is there a way to bring that back?
Well, I think there's efforts. I mean, I think the concierge thing is an effort to address that. There's a couple other models to address that. But, it really often, the pendulum has to swing so far that the value of providing stuff like that becomes more clear. You look at, England and other countries where, it's a government-run system, and, there's a whole undercurrent of private system that,
right.
We'll find some. So it depends. But yeah, sometimes it has to get really bad before the value of providing an alternative is obvious.
So what's your take on some of the concierge services?
I like them. I mean, I think obviously there's a barrier to entry because of the finances. So, for your typical person, it may not, be an option. So while I think it has a role, I think the barrier to entry is somewhat of a challenge. But what they do is, they spend a lot of time with you. You get an hour-long visit, and the doctors really care about, stuff that they normally wouldn't get to in a 10-minute visit. So in that sense, it's good. I just don't know how scalable that is for the general population.
Yeah, I wonder about that as well. I mean, I do that and love it. It's a great experience, but it's not cheap, and it's not for the masses. So I wonder, where is the healthcare going to go, longer term? Is that going to be the direction? Is it going to be a single payer system? And then just like in the UK, you have the private health outside of that. It's really interesting.
Yeah, I think it is interesting. I think, in terms of educating people, I think, the current system with its, sort of HMO style model of just being very efficient, whatever, often you don't notice the weaknesses on their program until, God forbid, you or someone is really sick. And then you get to see it. So it's all good and fine when you're just going in for a cold or a flu here and there. It's the real shortcomings of the system often present itself when you God forbid, you or someone else has a real serious issue. Then you can see, OMG, yeah, this is not optimal. So I think it's like anything else. When the pendulum goes so far, there'll be a backlash, and there'll be opportunities for people to create other ways that addresses some of those shortcomings.
Well, where can we learn more about you and about E7 Health, about U.S. drug testing centers and USTPA online?
Yeah. So the great place is BaktariMD.com. So that's our website. Also on YouTube, Baktari MD, if you want to watch our podcast. I'm also available on LinkedIn if you want to reach out to me. If anyone has any questions, if I can be of help or our company can be of any help to anyone, just reach out to us on any of those platforms and we'll get back to you.
Fantastic. We'll make sure and link all of that in the show notes. And
thank you.
Dr. Baktari, I have really enjoyed having you on the show today and very insightful.
Thank you for having me. It was a pleasure.
Thank you. Thanks again, Dr. Baktari, for coming on the show and sharing your insights and health tech wisdom. You can learn more about E7 Health and Dr. Baktari at e7health.com and, of course, drjonathanbaktari.com. Be sure to check out his Baktari MD podcast as well. As always, all links, highlights, resources, full show notes are available at saasfuel.com. You can subscribe or follow us there and check out video episodes on YouTube. It's a new channel. Everyone who subscribes this week will receive a collection of motivational fortune cookies filled with wisdom of successful entrepreneurs and endless encouragement. How about that? Join us next time on our SaaS Fuel Expert Series for Phil Alves, CEO and Principal Consultant at DevSquad. He's led the build of over 100 SaaS products. I said 100 SaaS products. You heard that right. For bootstrap founders and VC-funded startups alike, incredible insights from someone who's been there, done that like 100 times over. And our founder next week, so excited about this, is Nina Suri, founder and CEO of Zappa AI. It's a SaaS platform that leverages AI to assist organizations in streamlining their hiring process while eliminating bias. It's an amazing use for AI, and she's got such great insights into what she's doing there. So I will see you next time, and as always, enjoy the journey.
Thanks for listening to SaaS Fuel. Full show notes for each episode, which includes a summary, key takeaways, quotes, and any resources mentioned, are available at saasfuel.com. Be sure to follow and subscribe wherever you listen to podcasts. And if you're enjoying the content and getting value from these episodes, please leave us a rating and review at ratethispodcast.com/SaaSfuel. We'll be sure to read these out on future episodes.